So next, I'd like to introduce, I'm delighted to introduce my colleague, Dr. Tara French, who's talking on enabling digital inclusion in mental health, such an important topic. Tara is Programme Lead for Digital Inclusion within the Digital Health and Care Directorate in the Scottish Government. Tara, I know, is very passionate about digital inclusion and also human rights-based approaches to design. Tara has led the development of the care technologist role in social care, the co-production of human rights principles for digital health and care, and has driven forward the value of person-owned data and social care data in service design. I'm delighted to see you today and welcome, Tara.
Thank you very much, and thank you so much for the invitation to be here today. Really grateful to have the opportunity to share the work that we're doing around digital inclusion within mental health, and just like to acknowledge our partners in the programme, the Scottish Council for Voluntary Organisations, who've really been pioneering digital inclusion work across Scotland for many years now, and the driving force in Connecting Scotland as well, the huge programme that supported people throughout the pandemic. But today I wanted to share with you some of the work that we're doing in supporting digital inclusion in mental health. We have a new programme which launched in March this year, to support people across mental health and also in housing as well, to look at how we support people to be able to engage in digital and have access to all the different opportunities that being online can offer. And we've been developing with our partners in SCVO, with my colleague Aaron Slater, who's their digital participation manager there. We've been doing a lot of work around really drawing together a lot of the learnings that we've got about digital inclusion from the different work that's happened over the years. And we're still working on, what's that definition? And we've been kind of evolving this definition as we're going through the programme, and it will continue to evolve over the next couple of years. But really, we've been thinking about how we shift that perception of digital inclusion as, an individual responsibility, into more of a collective responsibility, and thinking about what are all of our roles in whichever part of the system that we're working in, to actually support people to be able to have access online. And when we think about health and social care in its kind of broadest sense, especially when we're thinking about developing or designing different digital interventions or services, digital inclusion needs to be absolutely fundamental. It's something that we should all be thinking about in our work around, if we are designing and developing digital ways of accessing services, how are we also building in that inclusion element for people who may not have a device, who may not have connectivity or the skills and confidence to get online, but might not even have that awareness of what being online means, and also the actual services themselves. How inclusive and accessible are they? How easy are they to navigate? When we're designing new interventions. And part of that is also thinking about digital choice, as Chris mentioned, which is kind of the central theme running through our digital health and care strategy in Scotland, to ensure that people not only are offered digital where there are digital choices to be made, but also where they can actually make that informed choice about whether to engage digitally or not in their support or their care. So to give a bit of an overview of the programme, as I mentioned, it launched in March this year. And we're working across the two different contexts. And what we're really looking to understand and to implement within each of these contexts is, what does that model of digital inclusion look like? How do we best enable people to be empowered, to be confident, to explore digital, and how do we support them to experience all of the opportunities and the different connections that being online can support with people more broadly across their whole life and their well-being. So we are in April earlier this year, we launched a fund which we called Digital Pioneers. We chose that term because there are so many organisations in Scotland who are already pioneering the way forward in digital inclusion and actively supporting people within the different communities where they're based to be able to have access to devices, to data, to skills and confidence to be able to get online. And within our mental health Digital Pioneers Fund, we have 6 projects, which are Cargom, Cyrenians, Just Be Productions, Moray Wellbeing Hub, Sahelia, and the Scottish Association for Mental Health, who are working across different areas of Scotland. And what's so important about this fund as well is that it very much is a learning fund. So these projects are working with different people in different mental health settings across the different geographies to really understand and learn how do we best support people to engage in digital, what are people's needs, and how do we really start to form what that model of digital inclusion needs to look like going forward, so that we can make that connection with the work that Chris and colleagues are doing to support people to be able to access all of the different forms of support that are available digitally as well, if they choose to. So part of the work that we've been doing, I spent many years in academia, so I love a framework. I love to look at, okay, how can we put something in place? So when I came into this role, the first thing I was doing was, looking at lots of the research out there, but also thinking about the learnings and recommendations that have come from various evaluations across digital inclusion work. And together with Aaron at SCVO, we've come up with these pillars for our SINs. And I can hear a lot of people say, oh, not another set of pillars, but that's what we're calling them just now. And again, it's very much for us to have these ground the work to make sure that we are cutting across and building knowledge across all of these different pillars within the work that we'll fund and within the evaluation that we'll do as well. And again, it's so that we can think about from those different levels of, as a person, if I am digitally excluded, what do I need? If I'm working in mental health, what do I need for my digital confidence as someone working in mental health to be able to support the people that I'm supporting to get online? And also at that organizational level, how are we seeing digital inclusion being prioritized across organizational policy and strategy within our different sectors as well? So just as an example, and I can share a link to the paper that was published in July that we've written. So we've gone through for each of these pillars, for the individual, for the workforce, for the organization, what do we need? What do we need to be thinking about for people's motivation? So bearing in mind that it's often a non-digital hook that might be the way to start to explore digital with someone, but also thinking about barriers around engaging in digital, such as fear, trust as well, is hugely important to people when making that choice whether to go online or not. Thinking about the type of device that's most appropriate for different people, may find different devices more easy to use, but also thinking about the purpose of why someone wants to get online and what they're going to be using that device for, and that's certainly something that we're learning from our Digital Pioneer project, is around the different types of devices that seem to be most appropriate and most suitable that people prefer. And also thinking about that connectivity. So especially, you know, in the cost of living crisis, where people are having to make really, really difficult choices. And connectivity is not cheap. It's very, very expensive to be able to have a data package or have broadband in your home. And then also, you know, it may be that people do have access to a device. They may have, you know, a place where they can go and connect, but actually it's that confidence or skills piece where people need to be supported to be able to get online. And then finally, if you're thinking about taking someone through this whole journey, they've got the motivation, you know, they've got the skills, they've got the ways and means to get online. How many of our services are actually inclusive and accessible? So once we're getting online to use these different platforms or different digital services, are they easy to navigate? Are they easy for us to access? One of the things that we're looking at through the program is to think about, okay, we have these pillars, we have our projects that we're funding. How can we actually translate the knowledge to make it useful for others? One of the things that we're co-producing for frontline staff is a digital inclusion practice guide. And within that, thinking about, you know, specifically for mental health, what does that practice guide need to include? Again, how do we best support people across a range of different settings in mental health? And we hope to have our first iteration of the practice guide in November, and then to do some wider co-production sessions to really focus in on the kind of topic based content as we go forward, so that we can ensure that staff again have that awareness, have the ways and means to be able to signpost to ways that people can get connected and get the support they need to get online. So just to chat through some next steps. So as I mentioned, we'll be doing those further co-production sessions for the practice guide. We're also going to do an in-depth review on each of the pillars that we have. We are doing some further engagement, and on the next couple of slides I've got ways to be involved in that. But the other thing that I haven't mentioned so far is we've also been doing some co-design work over the summer on digital champion training for mental health. So for if you're working in mental health, please do get in touch, because we're going to be rolling out that digital champions training in the new year for anyone in any sector that would like to take part in that. You're very welcome. And we also will have a further fund that we are designing at the moment that will open in January, called Connecting to Care. And I'm hoping this QR code will work. We have a couple of events happening in November. So again, if you're working in or you're providing support for mental health, please do join the session if you can. And at that session, we'll very much be focusing on the Connecting to Care Fund, thinking about how we enable partnerships, because we're really keen to see how do we start to, from the pioneers projects that we have that are giving us the learning around what works, giving us the insight from directly supporting people around what is important to them for digital inclusion and the way it needs to work. We then want to, in the next fund, really look at how do we embed this within core service delivery and be able to support people to connect to different services that they may wish to. So we'll be focusing on that in the stakeholder event. And also, if you have experience of accessing mental health services and support in Scotland, we are joining the Alliance Digital Citizen Panel. We have a conversation cafe happening on the 29th of November, where again we'll be focusing on capturing people's thoughts and ideas and their expertise for how do we make the work that we're doing, how do we drive that forward from people's lived experience, ensuring that's at the heart of what we do, but also thinking about when if you're being supported in mental health, how do you want to be introduced to digital inclusion? What should frontline staff, how should they be having those conversations? So really shaping a lot of the outputs that will come out from the programme as well. And yes, I think that's the couple of events that are happening. And if you would like more information, or please do reach out. Our webpage is in development, so we're still adding content on there, and again, looking at accessibility as well from practice and what we preach. So it's under development at the moment, but that will be the place where we'll be adding all of the information, everything that comes out of the programme, and that'll be the home for it there. So thank you so much, and yeah, we'll look forward to some questions and discussion in a second.
Thank you very much.